Hello everyone, this is Dr. Minis again. So whenever we're treating the patient of ACS, that is acute coronary syndrome, STEMI or NSTEMI, we load the patient with statin and dual antiplatelets, commonly aspirin and clopidogrel 300 mg, right? After that, we have to start the patient on dual antiplatelets for like 6 months or 12 months or lifelong based on the risk factors the patient is having or CHADVAS score, right? Now, we have to start the aspirin. With that, we have 3 options and which one to be selected. Right. So there are 3 options: Clopidogrel, Prasugrel and Ticagrelor. Okay. So when the Clopidogrel was launched, right, it was a wonderful drug, but they found out that many people are showing resistance toward the Clopidogrel. This is because, pharmacogenomics, as Clopidogrel is metabolized in the liver, so liver enzymes function differently in different people, right? So then these 2 drugs came to picture, Prasugrel and Ticagrelor. So we'll discuss one by one. Prasugrel is a wonderful drug, high potency, but it has more complications of bleeding complications. So it is contraindicated in the patients who's having a history of CVA or even TI episodes, which should not be given because there is high risk of bleeding now. Right. And also we should avoid the Prasugrel in the patients with weight less than 60 kgs or age more than 75 years, right? So they found out that there is more bleeding chances in these cases. But Prasugrel is best if there is no contraindications and the patient is planned to undergo PCI, that is angioplasty, right? And next drug is, the dose for Prasugrel is 60 mg loading and 10 mg OD. Right. The next drug is Ticagrelor. It is a wonderful drug with very less side effects, equal efficacy. The loading dose is 180 and after that 90 mg BD you have to give. And Ticagrelor, but the problem with it causes bronchoconstriction in 10 to 20% cases. So in that cases, you have to shift the patient from Ticagrelor to Prasugrel or Clopidogrel, right? But if there is mild dyspnea, not that much, we can wait and see if the patient can tolerate the drug or not. Right. So Ticagrelor can be given for any patient, either you plan for PCI, CABG or nothing, we can give it safely because it has more safe than Prasugrel. So what usually we have to do is, after the ACS, we load the patient and then we start antiplatelets. You choose aspirin, and if there is no contraindication of Prasugrel and if the patient's planned for PCI, give Prasugrel and aspirin. But if there are contraindications for Prasugrel, as age and CVA history is there, then you give Ticagrelor. Most cardiologists prefer Ticagrelor over Prasugrel. And aspirin, Ticagrelor, we can give for 6 months or 12 months dual antiplatelet therapy, and then we can shift the patient with single antiplatelet to the single antiplatelet, that is aspirin, or we can shift the patient from Ticagrelor or Prasugrel to the Clopidogrel, because Clopidogrel is safer than these 2 drugs. Thank you.